Direct Care Staff Responsibilities. At the end of this course, the student will understand the responsibilities of a direct care staff in an ICF DDH and understand the requirements of a direct care staff in an ICF DDH. Direct care staff job description. The direct care staff is under direct supervision and guidance of the QIDP. The direct care staff play the single most important role in the overall development and care of each individual person. The direct care staff's primary duty is to follow each person's ISP and provide active treatment. Direct care staff will promote individuals' health and well-being, promote individual independence in all critical skills development, implement specific objectives, be responsible for individual safety and health, which includes the passing of medication after successfully completing the training program, following individuals' nursing care procedures and all health monitoring responsibilities as assigned by the registered nurse, provide continuous and accurate documentation of each person's progress, problems, and special incidents on a daily basis, follow menus as written and approved by the dietitian for meal preparation while involving individuals, document house maintenance needs, complete house shift reports at the end of each shift, attend at least 3 hours per month of in-service training, perform assigned household duties involving individuals, participate in consultant evaluations, perform physical assisting of persons in caring for self-help and toileting needs, and be familiar with adaptive equipment, such as a wheelchair. Treat individuals with respect, must know individuals' rights, report any infringement of individuals' rights to the administrator, and complete the necessary documentation, maintain regular work attendance, be a positive representative of our corporation, report to administrator any observation of violation of established procedures or personnel policies. Other duties as assigned by the administrator, QIDP, or the registered nurse. Requirements: fingerprint clearance through the Department of Justice, some knowledge of developmental growth, the ability to work with and develop a person's potential, follow oral and written directions, write effectively, accept responsibilities, work and cooperate with others. Applicants will also be required to at least have a high school education and have some experience working with developmentally delayed in a residential setting or program setting. Direct care staff job duties. The knock shift. The knock shift position is an awake overnight position that is on a flex schedule from 10 to 12-hour shifts. The night shift direct care staff is responsible for supervising and ensuring the health and safety of the clients overnight. Client care duties. Make rounds of bedrooms every hour to assure clients are not in any distress. Monitor all equipment to assure it is working as indicated. Toilet clients. Please be sure to stick to their toilet training program as specified. Change bedding if soiled or wet. Assure each client brushes their teeth, washes their face and hands, or takes a shower before school if they wet the bed. Follow skills training guidelines and teach. Do not make the client dependent on you. Dress clients in appropriate clothing for school. No torn clothes. Shoes with holes in them, soiled or dirty clothes. Jackets and warm outerwear in the winter. Loose clothing in warm weather. Follow menu and client's diet orders, which are posted on the refrigerator and are in the client's charts. Implement active treatment at all times. You are teaching them. You are not doing everything for the client. All clients must gather their own grooming kits, hold their toothbrush, hand over hand if necessary when brushing teeth, wash their own face, wash self when taking a shower, and wipe self after toileting. You can help them by doing hand over hand, but your job is to let them learn the self-help skill. Make sure all clients' backpacks have a change of clothes and any forms from the day program or school that are sent back. Housekeeping duties and charting. Make all beds before leaving your shift. Clean bathrooms and mop all floors before leaving your shift. Strip beds, put on clean linen, and wipe beds down with Odoban if the client wet the bed during the night. Chart on the flow sheet program notes and behavior skills data sheet and the census form. Be sure to sign off on all med sheets. Wash dishes, put away, wipe down stove and refrigerator. Put dirty clothes in the washer, fold and put away all the clothes in the dryer. On Tuesday night, clean out the refrigerator, the top freezer, clean the client's grooming kits, and put in a new soap and toothpaste if needed. Wednesdays, clean the stove and the oven. Friday nights, clean out the freezer in the garage. Saturday night, clean out the refrigerator and the freezer. PM shift. The PM shift is after school until 7 or 10 p.m. at night. The PM shift direct care staff is responsible for supervising and ensuring the health and safety of the clients while on duty. Client care duties. Maintain eyesight and active supervision of the clients during your shift while clients are awake. Make sure clients wash their hands before eating and after using the toilet. Toilet clients on specified schedules and always before they go to bed and 1 hour after they go to bed. Toilet clients when they come home from school and after their snacks, before and after they go on outings. Assure each client brushes their teeth, washes their face and hands, or takes a shower before they go to bed. Follow skills training guidelines and teach. Do not make the client dependent on you. Dress clients in appropriate clothing for outings. No torn clothes, shoes with holes in them, or soiled or dirty clothes. Jackets and warm outerwear in winter, and loose clothing in warm weather. Follow menu when cooking and serving the family-style meals. Each client must have a full place setting at each meal. The client must set the table with everything except utensils. Maintain dignity and always follow procedure when tube feeding. Be aware of infection control and wash hands often, especially after feeding the client. Implement active treatment at all times. You are teaching them. You are not to do everything for the client. All clients must gather their own grooming kits if able to. Hold their toothbrush, hand over hand if necessary when brushing teeth, wash their own face, and wipe themselves when they're toileting. You can help them by doing hand over hand, but your job is to let them learn the self-help skill. Check all backpacks when they come home from school. Help clients with homework and post on bulletin board any notes from school or forms that need to be returned. Charting. You must chart on the flow sheets and data sheet at the end of each shift. You must write a brief program note about the client. Sign off meds when giving meds and chart special procedures. Housekeeping duties. Clean bathrooms and mop all floors before leaving your shift. Wash dishes, put away dishes, and wipe off stove and refrigerator. Wash clothes, fold, and put away all the clothes in the dryer. Put clothes out for the next day. Vacuum or sweep the living room.